Did you know that scar tissue is the main reason why it's getting harder for you to move? A foam roller is a phenomenal way to pin the scar tissue to a local bone to break it up. Hello vetted family, it is Joel, and today we're talking about the rectus femoris, which is the only quad muscle that spans two joints. It spans my knee and my hip. It's the only quad muscle that does hip flexion. So as one of the hip flexors, if it gets too tight, it'll tilt your pelvis in this position and put too much pressure on your lower back. So then your lower back might hurt. When you stand up, you'd want to stand up slowly because your hip flexors are too tight in general. But in this video, we're going to show you how to identify it, how to find it, and then how to break up the scar tissue in it. So I'm going to use a foam roller, and what I want you to do, I'm going to show you the setup. I don't want the foam roller here because I want you to isolate one rectus femoris so you can focus on the data more. I'm going to move it over a little bit, and when I go down, I'm going to put this leg into a frog stretch and put the roller directly on my thigh, and then come down on my forearms. I'm going to show you from a different position, but this is the setup. From the side, it'll look more like this. And what I want to do is I want to change the angle of my thigh to find this big cable-like structure, which is my rectus femoris, and it's so tight. So I know that I'm on it because I'm falling off of it now. So once I isolate it, I can do one of two things. I can do passive strokes on the spot that's the most tender, and that will break up the scar tissue as well. And I want to relax as much as I can. I don't want to be stressed out while I do it because I'll tense up the muscles. Also, so that's the passive release. I can do an active release on it. So with an active release, I'm going to pin one spot down, and the spot is tender, and I feel a ball of scar tissue. It's not smushy like my other tissues. And I will squeeze my hamstring to flex my knee, and now it's dragging that ball of scar tissue in between the foam roller and my femur. And it's going to break little pieces of it off, and they'll get absorbed into a local capillary bed, and I will recycle them for hair and bone tissue and organ walls. So this spot is already becoming less sensitive. As it becomes less sensitive, I can move to another spot. Typically, I would crawl up a little bit to move the roller down, and I can do the same action. I can also do it by my knee because remember, my rectus femoris spans my hip and my knee. So I can be in the middle and be on it. I can go up a little higher and be on it. Really what you want to do is use your sensory system wherever it's the most tender. Like for me, it's more tender up here, so I'm going to spend more time up at the top. And as we release, my sensory perception changes. It lets me know that it's less tender because I'm removing damage, and that signal goes away. So you want to do this probably for about 5 minutes. If you want to get better faster, do it longer. You won't do this too much.